Hi, my name is Greg Fell. I'm Director of Public Health in Sheffield. This is a short video on the vaccination programme. So the vaccination programme has started. That's all over the global media. We'll all have seen that. Currently there's one vaccine that's available to us, which is the Pfizer vaccine. In time there'll be two and probably three vaccines available to us, which dramatically increases the speed at which we can vaccinate the population. Clearly that's a good thing. My sense, I wouldn't want to second guess it, but my sense is that the AstraZeneca vaccine will be approved by the regulator in the very, very near future, possibly weeks, but I'm not cited on when that might be. And that will be fantastic because it increases the speed with which we can vaccinate, and also it's an easier to handle vaccine administratively and logistically. Lots have said to me in my inbox and elsewhere that the safety is the key issue, and they're worried about the safety of the vaccine. It's fair to say that there are very few, if any, signals in the data that's available thus far on the safety is a problem, other than really quite specific and relatively minor side effects that are associated with all vaccine. You know, the site-specific stuff. Some people say they have some minor feverish symptoms a few days after the vaccine, and that has been noted in the safety data, and that's noted in the safety data of all vaccines. But there's no major signal in any of the data on there being a safety concern about the vaccines that we've seen the data of thus far. The role of the regulator is to assess efficacy and safety of the vaccine, and as I say, the Pfizer vaccine has been approved by the regulator, the MHRA in this country, and it's a very, very, very robust regulatory process. There's no interference with that regulatory process. It's a world-renowned process, and that process has operated for many, many years, and they have worked very speedily, but certainly no corners have been cut. People will have concerns about whether or not they should have the vaccine. It's understandable. I suppose it's a kind of a balance of risks. What is the risk of having the vaccine itself? As I say, all of the data is really clear. There are no significant safety concerns that have been articulated in any of the data that's been published thus far. Balance against that the risk of the illness, and we've all seen that this is an illness that kills people. That is a quite serious risk, and those two things need to be balanced together. It's being rolled out by the NHS. It's being rolled out quickly. It is a significant logistic exercise, of that there is no doubt. Probably one of the biggest logistic exercises that the NHS will undertake in its history. The ordering of who should be vaccinated first, again, is fairly clearly set. The Joint Committee on Vaccination and Immunisation have set the ordering criteria for who gets vaccinated first, and it's very age related, so the very, very elderly and the very vulnerable will be highest on the priority ordering list. Care home residents are pretty high on the priority ordering list, and that's based on the risk of death. This is a vaccine that is there to reduce the risk of very serious illness and death, and that was the basis and the premise upon which the original studies were done. Is this a thing that reduces risk of death? And it does, no doubts about that. So thus the ordering of the who gets vaccinated first is done on that basis. There are unknowns still, and a really important unknown is, does it reduce the transmission of the illness? I.e., do we get into a position where vaccinated people can't transmit the illness to others? We don't know that. The studies were done on the basis of, does it reduce the risk of serious illness and death? It does, but we don't actually know. We're all making an assumption that also a happy side effect is that it reduces the risk of transmission. It probably will, but we'll need to keep a really, really careful watch on that. A few other things on that. We will need to get significant proportions of the population vaccinated before we get anywhere near an assumption of herd immunity. So I think we're going to need to vaccinate almost all of the initially eligible population before we've got anywhere near herd immunity, which is enough of the population vaccinated to provide protection to those who genuinely can't have the vaccine because of an underlying medical condition of one type or another. And we can all carry the virus on our hands. So even if I've been vaccinated and I can't transmit it via my respiratory droplets, I can still carry it on my hands. So for those two reasons alone, we won't be taking our eye off the nature of the pandemic, and we certainly shouldn't take our eye off the protective measures we can all make around washing our hands, wearing face coverings, keeping distance for some time to come yet. The last thing it's worth me saying is I see on social media there's a whole bunch of really interesting hypotheses out there around can it change my DNA? No is the answer. It can't. It's not physiologically possible. And there's a host of other really interesting theories out there on social media. I would encourage people to go to a very, very small number of places for really, really reliable information. The places I normally refer people to are the Public Health England or any gov.uk website, and actually the BBC website is pretty good as well. So just be careful about where you get your information from, because there are a lot of interesting and very untruthful stories out there about what the effects of the vaccine. So just my last point is be very careful where you get your information from. As I say, I normally point people to a gov.uk website.